With plans for a vaccine rollout well underway, getting it to people in remote parts of Australia will be an unprecedented mission for health authorities.
It's going to be a huge challenge. There's no doubt about that. It's something that we haven't really ever done before, a vaccination program on this scale.
Some jurisdictions have the challenge of a huge population. Our challenge is an area over a population over a sparse, remote area.
The Pfizer-BioNTech vaccine, which is likely to be the earliest one approved, requires storage temperatures of -70 degrees. It'll be a challenge getting it to people in isolated parts of the country, including Indigenous people living in the Northern Territory's remote communities and homelands. Dr. Webster says the transient population of many Indigenous communities might also make it difficult to fully vaccinate people using any vaccines that need 2 jabs.
There'll be challenges of making sure that those people get followed up for a subsequent or a second vaccine if they get the first one in Darwin, and then perhaps they go back to Gumbalanya and need a second one, for example.
Indigenous health groups have long expressed grave concerns about the consequences of an outbreak in remote communities with vulnerable populations. Under the federal government's distribution plan, Indigenous Australians aged 55 and above will be in the second priority group. For those living in remote areas, the AstraZeneca vaccine will be the jab of choice if approved next month, because it only requires regular refrigeration.
It's going to take many months to be able to get enough coverage in the community before life can return to anything like normal.
The first phase of the vaccine rollout is expected to begin next month, targeting frontline health workers and quarantine staff. Cameron Gooley, ABC News.